No, 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 no. You don't want to hurt the dog, Mark.
If there is one thing that defines hyperactive children, it is motion. Constant. Relentless.
Skateboard, Mom.
Vanita Warren says her son Samuel has been on the move since birth. By first grade, teachers often complained that he was not listening, disrupting class.
Go, 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 go. Can't sit still. Just interested in his surroundings.
But Vanita was stunned when school officials told her their patience was up. She had to pull Samuel out of school or put him on drugs.
And I'm thinking to myself, hello, you want to take a straight-A student and put him on drugs? This didn't match. It just basically sounded to me like you don't know how to handle him.
Back in the 1970s, only about 100,000 kids nationwide were on behavior-altering drugs, like Ritalin. Today, by some estimates, as many as 7 million children may be on psychotropic medications.
This is a worse epidemic than we ever had from street drugs.
Dr. Peter Breggin, a psychiatrist and critic of the wide use of Ritalin, says the reason for the sharp increase is simple. In our society, where parents are working too many hours, where teachers have too many students, where kids are involved in too many activities, there is simply no time for the child who will not do what he is told when he is told. So the drugs have become a way of calming those children down.
It's become expedient to use drugs rather than to reform the schools, rather than to improve our family life. In other words, instead of adult society taking responsibility for a more child-friendly and child-caring society, we're drugging the kids instead.
But not everyone finds fault with Ritalin. Consider the Peters family.
It doesn't, totally turn you into a zombie or anything like that, but it just helps you focus. What about...
Both David and Linda Peters are teachers, and their own daughter, Allison, has been on Ritalin for 6 years. Before the drug came into their lives, there were constant family conflicts. Just getting through homework each night was an ordeal.
And it was supposed to be about an hour a night, and it would take 3 to 4 hours for her to complete the homework.
Today, Allison gets her homework done, gets along with her family, and where once she couldn't even read a book without being sidetracked every few sentences, with Ritalin...
Once I was on it, I could sit down and I could read the book, read the chapter, and if I heard a noise in the other room, I could just continue reading it. I wouldn't be so distracted.
The simple truth is, many families and doctors say properly used Ritalin and other mood-altering drugs can be a godsend.
There are some kids who truly can't make it without the medication, without the stimulant, who, without the medicine, even in a specialized classroom, would have a really difficult time.
Hey, that was pretty good.
Dr. Jennifer Hagman, head of adolescent psychiatry at Denver's Children's Hospital, says what's more, teachers can play a critical role in determining which kids may need help.
I find that experienced teachers are pretty good at knowing when a child is having difficulties that are outside the realm of the average kid. Parents, I think, have a harder time sorting that out because they don't have the benefit of having seen, 30 kids a year come through their classes.
So where is the balance? The National Institutes of Health, in a conference on attention deficit hyperactivity disorder, the clinical name for the problem these kids suffer, concluded there is no consensus among doctors regarding which ADHD patients should be treated with psychostimulants. Follow-up to see how the drugs are affecting the kids may be inadequate and fragmented. And family doctors, the ones with the least expertise in ADHD, diagnose more quickly and prescribe medication more frequently. Put that doctor in an HMO, which won't pay for a psychiatric evaluation, and...
He's more likely to go ahead and treat, to try, give a stimulant a try.
Give them some Ritalin, give them
something. Exactly, and the kid goes away without having had testing or assessments back from the teacher, or contact with the school, or some of the other academic difficulties screened for.
For Peter Breggin, it all supports his theory that the spread of these drugs represents a social, not a scientific movement.
I think it's simply a wrong approach. And as long as we leave open the door to we'll drug some kids, we won't drug other kids, we'll have exactly the situation we have today, which is a lot of doctors using their own personal preferences on who they'll drug and who they won't drug.
These guys need to be fed if you want to go ahead and feed them.
Families who use the drugs
I get along better with my family because everyone's not always yelling at me or everyone else in our family to do stuff to get this done.
and families who don't
Hold on, yes, yep, I got it.
can both tell you their way works. Anita Warren is homeschooling Samuel now.
He's not having any problems. He's fine.
But the decision on how any hyperactive child is treated appears to depend much more on sheer chance than educated choice, on which doctor, which teacher the child runs into. And that, some psychiatrists suggest, could have dire consequences for the future health of millions of kids. It is estimated that since 1990, the number of school kids nationwide diagnosed with ADHD and subsequently put onto drugs such as Ritalin has increased 3 to 6 times. A notable exception to that trend, the Dallas public school system.
Gary, is that going to be okay with you? No medication.
Here, Dr. Glenn Pearson, the psychiatrist in charge of a district-wide mental health program, suggests what is going on in many other schools is unconscionable.
I'm very discouraged and angry. Ritalin makes everybody's life easier in the short run, but it contributes very little to the long-term positive outcome that we're all hoping for when we treat kids.
The mental health program here was started 7 years ago with a simple premise that children's emotional and mental needs are complex, require thorough evaluation and treatment, and usually the child alone is not the trouble. Jenny Jennings helped start the program.
I can't imagine any case where it's just the child has the problem. And that's why in our program we really do a family history, might visit the child at home, do observations at home and in the classroom.
Hello, Mr. Jackson. How are you?
In clinics like this one, every day, parents come in with their children to talk about their problems, not with just counselors, but with psychiatrists.
So, you got a report card.
And in this school district, just as in any other, many parents and teachers initially think their children are suffering from an attention problem.
Many of them come in and it's fairly obvious that that's not what's going on. There may be a component or there may be symptoms that are similar to what we'd see in ADHD, but they end up being a mood disorder, for instance.
Most of them have significant problems with social skills, with mood, with managing impulses, and with aggression.
All of which can be caused by many things other than ADHD. That is why the doctors here check out the child's physical development to make sure a nutritional deficiency is not to blame.
How much do you think you weigh?
They screen for learning disorders to see if that is causing tension.
At the end of the day, Mrs.
And they work with parents to see if something at home might be causing depression or frustration.
Everything else has been going okay?
Yes, ma'am.
Only after all of that do they even consider medication.
I like to have a kid in therapy and working and showing some understanding of his responsibility for his behavior before I give him the medication.
And just as the role of drugs is sharply constrained here, so is the role of teachers.
I don't believe the teacher's a mental health worker or a social worker. I think a teacher's there to teach.
Okay, let's go back here.
Teacher Kenneth Washington handles some of the kids with the worst behavior problems, and every day he sends home reports on their progress. He is consulted by their doctors, but when it comes to prescribing drugs...
I don't think as a teacher we had the right to tell a parent to put his son or daughter on Ritalin.
Well, some teachers think they not only have a right but a responsibility to do that.
No, we're not doctors.
Almost everyone here admits some kids do suffer from ADHD and may benefit from medication. But they say, look at the signs commonly used to diagnose hyperactive behavior. Almost constant fidgeting and restlessness, not sitting in the same seat very long, running or climbing at the wrong time or place, talking too much, always playing